Hi, I'm Dr. Fiona Willer. I'm the President of Dietitians Australia, and I'm here today to formally ask the government to ratify a prescription for a dietitian every time a GLP-1 weight loss medication is prescribed in Australia for any reason. We know that without a prescription to a dietitian for nutrition counselling support, that these medications will not reach the effectiveness that they could have had, and so it's throwing money away if dietitians are not prescribed with. This is an important issue. These medications affect appetite, they affect intake quite severely, and without nutrition support, people in any size of body can end up malnourished, including protein energy malnutrition, as well as nutrient deficiencies. It's of critical importance to make these medications work properly and work for the long term that a dietitian's prescribed at the same time. I'd like to introduce Dr. Terry Lynn South to talk about some of the medical issues here.
Thank you very much. I'm Dr. Terry Lynn South. I'm a GP. I'm also an accredited practicing dietitian. I'm the chair of the RACGP specific interest group in obesity management. And from my perspective, I think it's really important that people understand that obesity is a chronic, complex condition. And it's really about health gains and not just weight loss. And in this new era of very potent GLP-1 injectable medications, we actually need wraparound care for these medications to work best for those health gains. I think a lot of people don't understand that when the research for these medications came about, there was a bedrock of intervention from a diet and lifestyle point of view. And so if we want the same sort of improvements in health, improvements in obesity management, these prescriptions need to come with that bedrock of care, which is dietary as well as lifestyle interventions, but our current system does not necessarily support that best care. So GLP-1s are a tool, but they're a tool that needs to be used well with wraparound care for the individual patient. Thank you.
Does anybody have any questions?
I guess we've not seen the rapid rise of these drugs used, particularly in the last couple of years. How prevalent is it? And now obviously that you're talking about, how much does something need to be done?
So we know that people are accessing these drugs through their GPs, but also through providers that they don't have an ongoing relationship with. And so while the actual users of GLP-1s in Australia at the moment numerically are less small, within the next 5 to 10 years, we will be seeing a huge wave of use. And without this extra support from a dietitian, we could be in strife.
And how are these drugs being used incorrectly, if obviously without your support?
So when we focus just on weight change, we end up losing the entire health piece. And so if somebody's chasing just a number on the scale, it means that they will be doing so potentially to the detriment of their nourishment, and that's what we want to avoid, because we don't need a malnourished small person. We need a well-nourished, healthy person at whatever weight they end up at.
And what's the breakdown? How many people are using these effectively, and how many people are having issues as part of an overall health plan? How often are you seeing it as the professional that we like, I need to do more work now because the groundwork hasn't been done yet?
Do you want to take that one?
I think we need to understand that particularly these more potent GLP-1 medications have only been in Australia for around 12 to 18 months, so we don't really have the data. The lower dose GLP-1s have been in Australia since 2018 for the treatment of type 2 diabetes, but they're at half the dose of what we're seeing with these more potent obesity management medications. So we don't really have the data yet. And like Fiona was saying, we've got 3 GLP-1 medications in Australia and more are coming. So we really do need to prepare the groundwork for more medications being used more often.
I guess, like following on from that, we are seeing the use of all the GLP-1, particularly everyone sort of knows the word Ozempic. How much is this going to be an issue? As you said, we're only at the start of this journey, so how much is this going to be an issue if we don't make change now within the next, say, 10 years?
I think it will be a huge issue. I really think we need to change the narrative that obesity management is not just weight loss. It's about health gains. And particularly, these medications, I can now prescribe them for type 2 diabetes. I can prescribe them for obesity management. I can prescribe them for reducing the risk of cardiovascular disease. I can prescribe them for obstructive sleep apnea. And as of last week, I can prescribe it to reduce the ongoing progression of chronic kidney disease. So having all of those other health conditions is showing you it's around improving their health and not about chasing, like Fiona said, a number on the scale.
There are recent reports out of the UK that dozens of people dying after using this kind of product, potentially due to underlying conditions. But are you concerned about these reports? And is Australia also actively monitoring these
I believe I heard you correctly, but I think you're talking about the risk of pancreatitis, is that right?
Sorry, that people are dying after using weight loss drugs. These reports come out of the UK.
Dying from pancreatitis?
I'm not sure, sorry.
Was that the one that we...
Yes.
Oh, yes, it is. So yeah, I think we need to understand that, yes, there are a number of potential risks in using these medications, and the increased risk of pancreatitis is not unknown. So this is not new, that there is a very small increased risk of pancreatitis from the trial data that we have, around 1 in 1,000. And I think this also shows you why it's really important for when new medications come into Australia that we do have this wonderful system called the Black Triangle Monitoring System. So we're looking for safety signals that we may not have seen or may be greater than what we saw in the original research. But although you have those very static numbers, to interpret that we really need to see how many of people were having pancreatitis and having severe consequences of that versus the number of prescriptions to see whether that is greater safety signal than what we thought in the trials. I think the other thing to understand is that people will have individual risks for pancreatitis. So prior pancreatitis, gallstones, high alcohol intake, and type 2 diabetes themselves have an increased risk of pancreatitis. So if that patient population are also taking GLP-1s, which we know has a slight increased risk, that may explain some of those numbers that we're seeing.
Also, the UK's advertising regulator has been investigating several instances of alleged inappropriate marketing of these drugs. And recently, Serena Williams has come under fire for promoting and promoting advertising. Does this sort of marketing concern you?
So I'll answer that in two separate ways. Yes, direct-to-consumer marketing really does worry me. Particularly because I feel as though there's lots of conversations about weight loss, whereas I believe that only obesity management is about health gains and not just weight loss. And I'm concerned about the overlay of body image and striving for a thin ideal. I cannot speak specifically about Serena Williams, but I do wonder, someone who might be in what we call an obviously straight weight or not living in a larger body, they can still potentially benefit from the health positives of GLP-1, but it might be about blood glucose control. It might be about fatty liver disease. It might be other things that are not specifically obesity management.
Building on that, how big of an issue as health professionals, and obviously looking at it in a more overall health plan way, so not chasing just the number, how much of an issue at the moment is it, I guess, people looking to take an easy option with dramatic weight loss quickly without maybe putting the work as an overall health plan? Maybe to ask both of you from sort of different perspectives, how much of an issue is a moment, and how much do we need to have a better plan moving forward if we learn to live with the pros and the cons of these drugs?
I'm very concerned about that. I can't tell you how much of an issue it is yet because we've only had these drugs for the last 12 to 18 months, but I think it's a true worry, and my own personal experience as a healthcare professional is in some ways we can be doing, our improvements of understanding the different physiologies and the acceptance of different size diversity. I think in some ways there is a risk that these GLP-1 medications used in the wrong instances is actually undermining some of the gains that we've achieved in that area.
The important thing is that we can't tell how somebody eats by what they look like, whether that's a larger body or a smaller body. But we tend to think that if there's weight change, that there's something specific going on with food. Sometimes there is, sometimes there isn't. And so it's really important. Anyone who's considering using a GLP-1, whether they think it's an easy way or not, that they could fall down the trap of undernutrition very easily. And we really want to unpack for them why they want to change their body weight. Is it health or is it body image? There's a whole lot more reasons why we need a multidisciplinary care team involved in that.
And is it, how would you like to see them incorporated? Because obviously some of the issues which you both alluded to is that people who probably don't need them slight changes to diet or exercise could just solve the problem themselves. What would you like to see? What's the good middle ground to be able to use these in a practical, healthy and safe way, or also understanding that for things like diabetes, they're important drugs as well?
Yeah, I'd really like to see a system where people can have really deep conversations with their healthcare providers about both health and nutrition and their weight, so that they can really realise that you're not swapping one for the other, and that a really complex understanding of their own situation is necessary. It's not just a number on the scale.
I did just want to offer as well, I think there was some of the journals that wanted consumer advocate as
Yes.
well. Andrew Wilson is from the Weight Issues Network. Interesting.
Yep.
Yep.
You've got to go right up close.
All right. Hi, my name's Andrew Wilson. I'm for the Weight Issues Network, which is a peak body for people living with obesity in Australia.
Andrew, I guess could you take it through some of those similar questions that we've already asked? How prevalent are you seeing issues around these types of drugs? How would you like to see them used, and how are you currently seeing them used?
So firstly, we're an independent organisation, so coming for a treatment neutral approach, but we see that these types of medications give people a chance to pause and maybe look at their health in a more holistic manner. So what a lot of people don't understand is when you are in a bigger body, particularly in the larger spectrum, like your Hollywood 10, 15 kilogram overweight type thing, that it's a constant battle to stop yourself from wanting to eat, because often the food is a coping mechanism for other things. Not always, but quite often. So if you're taking that away from somebody without some level of support, it's going to be a problem. It is. If you're taking away that coping mechanism, that will be problematic and can have dire effects if you're not looking after those people properly. So with that pause, with that ability to stop, regather yourself, because you're not having all that mental health, that kind of people call it brain fog, and it's a real thing. It can give you a chance to focus on your nutrition, for example, the food that you're eating, movement too. Getting yourself out there and moving. Mental health, which is a big understated thing, maybe able to start working on that, because most of these people in bigger bodies, including myself, there's a lot of stigma behind it. People are made to feel that it's their fault that they're in bigger bodies. Nobody chooses to be in a bigger body. Nobody chooses to be walking around and being a spectacle for other people. So I think there just needs to be a little bit more compassion, because it's not a deliberate thing. There shouldn't be judgment on that. And people just want to get help, that's basically, and most importantly, the people who are at the precipice, the people who are really fighting this battle, who are on the edge of some really nasty things, they're the ones who we should focus on with any treatments first. They're the ones, and if you're going to use these pharmacotherapies, make sure you've got the support in the background, because if you don't have the support in the background, you may get some fleeting weight loss, but if you're not working on all the other lifestyle, the holistic approach, it'll be short term. And if you do work on those things, you can have a much more success rather than and it would be a waste of money if you're just throwing this magic pill expecting it's going to do everything for you, because it won't. It's just a tool.
So how do we best, that's beautifully said, how do we best move forward to make sure that is happening? In particular, when you talk about that top end of the spectrum, the people who really need help, the people that really need these drugs.
Yeah.
And then at the other end of the scale, you might see people who don't need them. How do we best make sure that this is getting targeted to the people that need it with an overall?
Well, the way we see, because we're a lived experience group, we're the people who are at the coalface, who've experienced it all our lives. We feel it's a human rights issue. It's a discrimination to choose not to support these people with treatments and whatever modality you're talking about. We will do it for everybody else. We'll do it with people with cancer, with all different kinds of chronic diseases. But because it's perceived that it's our own fault for doing this, we don't think we need to cover it. We don't think so. I think that people, like I said before, people with the real issues, let's start with them first. Let's make that available on the PBS for those people to start with, and also not just offer that, because it's not a magic pill or a silver bullet. We need the wraparound care to make sure it's effective and not a waste of money. However we do that.
So going off that, because that's a really good point. As a lived experience group, whether through your own or people that you have been very close to, can we talk about some of the good news stories, some of the positives that you've seen by using these drugs in incorporating a healthy overall holistic plan? So could you maybe talk us through some of the great examples of that you've seen? Then maybe also on the other side talk about when people don't use it as part of an overall plan and just go straight for the drug and hoping that it solves all their issues.
If people are supported through it, like the big obstacle is stigma, and there's a lot of self-hate, a lot of horrible self-talk in bigger people's lives. You know, I'm not going to say what we say to ourselves, but something you wouldn't say to your worst enemy. So once you get over the stigma, getting some help, feeling more positive, you're losing weight. More importantly, you're feeling healthier. You know, maybe your blood sugars come down, maybe there's less medications. Maybe you're going back into the workforce. You know, you're feeling less stigmatized. Maybe you're reconnecting to the community. I mean, a lot of these things I'm talking about from myself and also from learned experience. Going back to work. I mean, not being somebody who's isolated. Because when you isolate yourself and you've got a family, you're isolating your family too. You're not just affecting you, you're affecting your family too. There's knock-on effects. There's economic effects. So it can be vast. Like for me, I reconnected with my community. I do a lot of community stuff, a lot of volunteer stuff. That's great for me. I feel good about that. But if you're at the other end, so when you're not getting the help, and you think, oh, I've got this magic pill, or I've had bariatric surgery, and I've done it now, I can eat whatever I want. It's not true, because when that cycle comes down and you start spiraling again, the worst part is you feel like a double failure, because not only were you a failure to start with in your own eyes and other people's eyes, but now you've had the magic pill or you've had the surgery and you've lost again. So I know people who are in that right now, and it's a horrible place. So we need the wraparound care, undoubtedly.
It sounds like you have a really good understanding of this from your own experiences. What would your message be to people who are maybe more at the start of this journey, who are trying to do this the right way, trying to incorporate balance of drugs, diet, healthcare professionals, getting their scripts in the right place? What would you tell somebody who's in that bad place, who's going through a tough time, has maybe failed a few times before? What's your message?
And most of us have failed repeatedly, for decades, and that failure has fatigued a lot of people. They rely on, there's a big weight loss industry. There's a lot of money in misinformation. So unfortunately, that's what's prevalent. That's what we can access on TikTok or whatever. So don't listen to that stuff. Get some professional help. You need to reduce your stigma. So I would join lived experience groups. I know it's a bit of self-interest. We're the Weight Issues Network. We have a lot of people lived experience, a vast majority. And what that does, often we have people who join our groups. We have a lot of online meetings. People will start the meeting maybe not showing their face. They're so stigmatized they don't want to even be seen in public. But as a community grows and you learn about the science of obesity, that it's not just your fault, people then understand there's more to it. And now that you're open to get actually professional help, not weight loss industry rubbish help, but professional help, from professionals who understand what you need to do, that's a big part of it. And then try and seek the help. But the problem is there's very little of that. For bariatric surgery, I think it's roughly 5% in the public health system. For pharmacotherapy, for obesity, it's zero on the PBS. So zero. We're talking about end of life, end of stage. People aren't getting access to it. And also obesity is nuanced. So we're not all big. Not everybody's the extreme end. So it's nuanced throughout that spectrum. There's going to be different solutions for people, for different people. It's not one approach. But getting professional help is the way to go. And feeling better up in your head about it, number one.
it's obviously going back to what we sort of said at the start. Do you think whether it's surgery, whether it's drugs, whether it's something else, how important do you think it is to use that healthcare professional on your journey to get that, and maybe not look at that on social media, and not just go straight to the drug without incorporating the plan in the first place?
So very important for all those reasons I've said before. You need the professional help, you need somebody to keep you on track. There can be complications with these things, and if you're not being supported, you can go in and just left to your own whim to look after yourself, and you're not doing well, you can go into a downward spiral and make things so much worse. So you need the help. You need to be honest. You need to be honest with yourself. I need help. I don't know what to do. I'm going to go get some help. And hopefully there's help out there. Fingers crossed.
And that would be your message too to somebody maybe watching this today who's been wanting to do something but hasn't quite done it yet? What I'd say to them? Yeah, is get educated. You need to get educated on this subject. You can't expect to learn stuff through social media. You've got to find out what the truth is. So connect with people who know that. That's patient groups, that's these professional organisations, and be open to it, because it hasn't worked. Whatever you've done in the past hasn't worked. Often you're repeating the same cycle and you get burnt out. It's a fatigue. You're going up and down, and eventually you get tired of it. So just get out there, be positive, have a positive mindset, get your supporters around you, get your people who are supporting you, and that will be a big, big help to getting there. Thanks.
Thank you so much, everyone. We are going to take a couple of crews downstairs, down to the outside area, so if anyone needs anything else, you're welcome to join us. But if not, thank you so much for your attendance. Great.